Welcome to our channel. Today, we're diving into the world of antidepressants. These medications are incredibly versatile, treating conditions from depression to anxiety and chronic pain. Let's break down how they work, the different types, and their potential side effects. First up, let's talk about SSRIs, or selective serotonin reuptake inhibitors. Serotonin is our brain's feel-good chemical, regulating mood, sleep, and appetite. Sometimes our brains don't produce enough serotonin, leading to feelings of sadness or anxiety. SSRIs act like traffic controllers, blocking the reabsorption of serotonin, keeping more of it available. This boosts your mood and eases anxious feelings. SSRIs are generally well tolerated, but they can come with mild side effects like nausea or trouble sleeping. Everyone reacts differently to medication, so what works for one might not work for another. Common SSRIs include fluoxetine, prozac, sertraline, zoloft, and escitalopram, Lexapro. These are often the first line of treatment for depression and anxiety due to their effectiveness and low risk of serious side effects. Remember, it's crucial to talk to your doctor to figure out if an SSRI is right for you. Discuss any concerns you might have about potential side effects. Let's move on to the next type of antidepressant. Next up, we have SNRIs, or serotonin norepinephrine reuptake inhibitors. SNRIs target both serotonin and norepinephrine, the brain's alertness chemical. By increasing both, SNRIs can be effective for depression and anxiety, especially with fatigue. They can sometimes lead to a mild increase in blood pressure, which your doctor will monitor. Other side effects are similar to SSRIs: nausea, insomnia, or changes in appetite. Examples include venlafaxine, Effexor, and duloxetine, Cymbalta, which also treats chronic pain. This shows how antidepressants can extend beyond mood regulation. Always have an open conversation with your doctor to determine if an SNRI is right for you. Now let's look at another class of antidepressants. Let's travel back in time to discuss TCAs, or tricyclic antidepressants. These were some of the first antidepressants, increasing serotonin and norepinephrine levels. TCAs affect other neurotransmitters too, leading to more side effects like dry mouth, blurry vision, and constipation. They're not usually the first choice today unless other medications haven't worked. TCAs are still effective for some, treating conditions like chronic pain and migraines. Common TCAs include amitriptyline, Elavil, and nortriptyline, Pamelor. Discuss potential side effects with your doctor to see if a TCA is the best option for you. Now let's talk about the OG antidepressants, MAOIs, or monoamine oxidase inhibitors. MAOIs inhibit an enzyme that breaks down neurotransmitters like serotonin and dopamine. This allows mood-boosting chemicals to stay longer in your brain. However, MAOIs interact with certain foods and medications, leading to dangerous spikes in blood pressure. Examples include phenelzine, Nardil, and tranylcypromine, Parnate. MAOIs are generally reserved for cases where other antidepressants haven't worked. Last but not least, we have the atypical antidepressants. This category includes medications that don't fit into other categories, each working uniquely. Bupropion, Wellbutrin, affects dopamine linked to mood, motivation, and attention. It's a good choice for depression with fatigue or difficulty concentrating. Mirtazapine, Remeron, enhances norepinephrine and serotonin, known for its sedative effects. Trazodone, Deserel, is primarily a sleep aid, but also effective for anxiety and depression. Atypical antidepressants offer options for those who haven't found success with other types. Now let's wrap things up. Thanks for watching. We've covered SSRIs, SNRIs, MAOIs, and atypical antidepressants. Finding the right antidepressant is a journey, so talk to your doctor and be open about your symptoms. Remember, antidepressants are not a one-size-fits-all solution. If you found this video helpful, like, share, and subscribe for more content. Always consult a healthcare professional for personalized advice. See you next time. Like, share, and subscribe to the Diseases and Cure channel.